This video will be on how to do a basic admission order set. First, you go into CPOE and you select your patient. In this example, we are using a test patient, Foxtrot W Train 4. Once you've selected the name, you click Order. I highly recommend that you always start with allergies, because if there are no allergies entered, it will not allow you to submit your order set at the end of the admission, which means that you'll have to start all over and enter allergies. So we'll have a different session on allergies, but this is the tab that you hit, and we will tell you how to do the allergies in the next session. Let's hit File and go to Med Reconciliation. Click Med Reconciliation, and this will open up the patient's medications. Here we will take out old medications, we will put in new medications, we will DC some, we will continue some. This will also be in a separate video. Let's hit Return. Here we are going to order sets. This will bring up the general medicine order sets. Let's go to Medicine Admission, and it will give us a choice of different diagnoses that are common for medicine admissions, such as stroke, heart failure, GI bleed, chest pain. This patient is a 74-year-old male with past medical history of diabetes, hypertension, who is coming in with acute diverticulitis. So for this patient, we will go under General Medicine Admission. Click that, hit Done, and this will populate. I want to bring you back. Let's hit Cancel. Yes. And I want to show you. Let's go back to Order Sets. Go back to Medicine Admission. Go back to General Admission. Under here, you can see a bunch of short sets. So this patient is a diabetic, so normally we would click insulin, and that would populate with another set that we have to complete. And here we would also pick pain, because we need pain control in this patient. We will have another session on the short order sets, but I want you to remember that for each admission, you want to check the boxes of the short order sets that you plan to complete. So let's hit Done again. And again, this will populate with the general medicine admission. Let's start with patient admission status. These are always checked ahead of time because these are required for every admission. So let's go to the red pencil, admit order, cosigner. You'll hit F9. On this particular application, I have to hit the binoculars. So let's do N / and SAR. I'll be the attending. F9 pulls up my name. Click. Admitting provider, same, SAR. F9. Jennifer Sargent, selected. Level of care is going to be inpatient, Y, enter. Admit to inpatient, again, F9. Acute adult, okay, because we anticipate the patient to stay 2 or more midnights. Let's go to reason for admission. We're going to say diverticulitis, okay. Code status, let's go to the red pencil. Code status, again, F9. Full code. If the patient is DNR, DNI, then you want to fill out the forms. Okay. Yes, confirm. Covered by, click the red pencil. Again, F9. This will give you the choice of teams. In this example, we use the blue team. The resident, we'll do Dr. Abraham. F9. And we'll find Sanu Abraham. Click. It populates with her pager. Okay. Tobacco screening. We'll go to the red pencil. Our patient happens to smoke a half a pack of cigarettes a day. So let's go to the F9, greater than 5 cigarettes a day. Medical reasons for not ordering replacement therapy, F9. No contraindication. And is patient interested in nicotine replacement therapy? Yes. Enter. F9 to select the therapy. We'll do 21 milligram patch. Okay. The nicotine patch will come up at the end of our order set. Vital signs. We'll click vital signs while awake. Respiratory. So if our patient's on oxygen or needs incentive spirometry, we'll select that. So say we want him to have incentive spirometry, we'd click the box. We don't need to click the blue pencil, but if we did, it would show us how often the patient would have it. In this case, it's every shift. Okay. Okay, we can always change that. Here, activity, ambulate. This will populate as ambulate as tolerated. We can always change it to bed rest. Nursing. These are nursing instructions. In our patient, we would do finger stick, AC, and HS, but this will also come in our insulin order set. So I'm not going to click it yet. Okay, say we had a heart failure patient, intake and output, but that'll also be in the heart failure order set. Let's go down. If our patient had diarrhea, we'd be clicking isolation contact plus C. diff, but our patient does not. Dietary, we don't want our patient to eat. Click. In addition to primary diet, N, no. Enter an N for NPO for planned procedure, no. Start date, T for today, N for now, and hit OK. Let's scroll down to IV fluids. I want my patient to have IV fluids, so let's go to normal saline, click that box. But I want my patient to have this at 75 an hour, so I'm going to change this with the pencil. Pull down, 75 ml an hour, OK. Let's scroll down. VTE risk assessment. This is required on all admissions. Risk assessment. By the Padua score calculator, our patient is high risk. So let's click the binoculars, high risk, or F9. Reason pharmacological prophylaxis not indicated, F9. No contraindications, pharmacological prophylaxis, F9. We'll say enoxaparin. Reason mechanical prophylaxis not indicated, F9. No contraindications. Mechanical prophylaxis, F9. Let's not do them because pharmacological therapy was ordered. Close. Okay. If we wanted fever management, we would have these options. If the patient was nauseous with vomiting, we'd have these options. As I look up, I see that the enoxaparin is still red, so this is an area that I have not completed. So let's go back to that. This is just telling the pharmacy the directions. So let's click OK, so it's ready to file at the end. Okay. This would be for nausea, vomiting again. We're not going to give anything. This will be for constipation. Here are all reminding us to do our short order sets, which we'll have another session on. And this is for our labs. I am going to click a CBC. This is for tomorrow, if you notice. And today is actually the 27th. So if I want it for later today, I click here and I can change the time. So say I want it for 3 p.m. Okay. But actually I look, it was for the 28th. I want it for the 27th. So let's make sure we have the right date. Okay. Nurse draw, no. Okay. But now I want LFTs. So let's go to add. Okay. LFTs. I typed in LFT, select, but I want this for today. So let's click over here, go to the 27th, and let's go 3 p.m. Okay. Okay. Done. still red, which means I did not provide all the correct information. Basically, it wants me to tab through. Nurse draw, no. Enter. Add on, no. So we want a new specimen. Okay. Here, if I want a consultant, so if I want GI to see the patient, I click GI. I put in the consultant's last name, A-N-A, F9. It shows Dr. Anand. And say we want diverticulitis. Okay. Okay. Looks like I'm almost done, but what did I forget? I forgot the antibiotics. Okay. So that would be under Add More, Medications. And for diverticulitis, which we'll show you in another order set, it would be ceftriaxone, IV, 2 grams, Q24 hours, done. And then we go to indications that do not require ID approval, F9, intra-abdominal infection. The newer sets will actually say acute diverticulitis. Okay. Suspected infection. Done. Done. Again, in this patient, I'll be adding a pain order set, and I will also be adding an insulin, but we'll do that in another session. So I noticed that this right here still needs to be completed. Say I don't complete that. I hit done. It will actually come up at the very end. So it will require me to complete. Let's hit OK. It just wants me to agree with the instructions. Submit. Put in your password. Enter. And here's your basic order set.